My name is Reginald James Davis, MD, and I'm a neurosurgeon at Laser Spine. I'm the Director of Clinical and Medical Research and Innovation. I was born and raised in a small town, Mansfield, Ohio. I went to college, actually, in a small university, Marietta College in southeastern Ohio. From there, I matriculated into Johns Hopkins Medical School. Remained there for the duration of medical school, surgical internship and residency, neurosurgical internship and residency, and I also did a research fellowship during my neurosurgical training, and I was the neurosurgical assistant chief of service. Remained on faculty at Hopkins as a assistant professor of neurosurgery in the private faculty, while I maintained a private practice in the community in Baltimore. As a 12-year-old, in those days, one would graduate, so to speak, from elementary school to middle school, or junior high school as it was called. As part of our graduation ceremony, our teacher challenged us to decide what we'd like to do with our lives, what we wanted to be when we grow up, in essence. But she took it a step further and said, not only do I want you to state what you want to do, but research what it would take to do that, and then explain why. And so under those circumstances, I decided in reverse engineering, I wanted to help people. I wanted to be successful and respected, and being a physician or a doctor would accomplish those goals. And if you're going to be anything, then be the best. And the top of the food chain was being a neurosurgeon. And my research actually led me to come to the conclusion that Johns Hopkins was one of the premier neurosurgical programs in the country. So I decided that I wanted to be a Johns Hopkins neurosurgeon. And in a small community, you make a statement like that as a child, it sticks with you for the rest of your life, and here I am. There were many things that made me want to join Laser Spine Institute. One was the phase of my career. I felt that I accomplished a great deal, and that the next level of accomplishment was really high technology, minimally invasive outpatient surgery, which was a little bit more difficult to achieve where I was. And so that would be the push or the desire to evolve. Secondly, as I did the research on Laser Spine Institute, I found that it was one of the premier institutes in outpatient ambulatory spine surgery, really at the leading edge and really a market leader. Probably the most compelling reason for coming, though, was as I got to know the people. I actually got to hear a little bit about Laser Spine. I was invited to come, and coming and just spending a day watching the camaraderie, watching the interaction between the staff and the physicians and the physician and the patients, and most importantly, just seeing these patients come in severe pain. Their lives are devastated. Then almost immediately after surgery, their lives are so changed that oftentimes there's just tears of joy in the recovery room. I'd never seen anything like it, and I saw it 5 times that day. And I decided then and there I desperately needed to be a part of this, and hopefully I would be able to add to the LSI legacy with my own efforts.